Okay, this is part one of one of my recent books called Prevent and Reverse Stroke and Heart Attack. And right on the opening page, I like to put a picture. I put the picture of Christ on the cross here with the spear of Longinus, the Roman centurion, going into his side. One of the angels collects the blood into a cup, which is the Holy Grail. Note that Christ has 5 wounds, one in each hand and one in each foot, and then the wound in his side. So those are the 5 wounds of Christ. A rather spectacular crucifixion scene here by Gaudenzio Ferrari, 1513. One of these Italian artists. They got a great sense of story. Okay, now here you see the 5 wounds of the village idiot. And this is somebody who's gone for coronary artery bypass graft surgery. We call it a cabbage. So he's got a wound in the groin. That's from the cardiac cath before the procedure, the coronary angiogram. They always put a sheath into the common femoral artery, common femoral vein. Then when he actually has the surgery, they float a Swan-Ganz catheter, pulmonary artery wedge pressure catheter through the right internal jugular vein across the right heart, out into the right ventricle, into the pulmonary artery. Okay, then they do a wound across the midline sternum. That's a sternotomy to get and then split the chest to get access to the coronary arteries to sew in the bypass graft. They'll do a Lehman to the LAD, left anterior mammary artery to the left anterior descending artery. And then they put in a mediastinal tube up the middle and a left chest tube. Those are the 5 wounds of the village idiot. And the reason I call it the village idiot is because, how much does that increase longevity? Overall, about 0, okay? Versus you go low-fat vegan, you cure coronary artery disease. So you can have a cure for free. You got to buy food anyways. Or you can have this procedure cost $150,000, $200,000, and it's not going to increase your longevity with a lot of potential for serious complications, including cognitive decline, pump head, kidney failure, death, multi-organ failure, okay? Stents also, they don't increase longevity other than during an acute myocardial infarction. Both those procedures are very expensive, very overrated. So that's why I say only a village idiot would go for that when he knows he can go low-fat vegan for free. Okay, then this is sort of like a mini acknowledgments to some of the people who pioneered the low-fat vegan diet, including, the great Dr. Walter Kempner, Caldwell Esselstyn, Dean Ornish, David Blankenthorne, Nathan Pritikin, Walter Kempner, Mark Armstrong, a whole bunch of researchers in there and people who kept it alive, the low-fat vegan diet, okay? Gregory Sloop and many others, Dr. McDougall and many others, okay? All right, disclaimer, this is just educational. I'm not your doctor. I'm not doing telehealth. I'm just providing educational books and videos. Your blood pressure and your blood sugar are going to drop like a rock, so you got to make sure you titrate these medication dosages if you're on any and work with your physician. Okay, FAQs for atherosclerosis. The first big question about atherosclerosis, and your doctor does not know this, almost none of them do, less than 1 in 1,000. Atherosclerosis is a blood clot. Once you get that, you'll be able to understand a tremendous amount of things. So anything that increases blood clotting increases the risk of atherosclerosis. And what is an atherosclerotic plaque? It's just an organized hematoma along the side of an arterial wall. Okay, it took me 30 years to learn that. Okay, like I said, 99.9 or more percent of doctors don't know that, as simple as that is, because their books are a joke. That's why I have rewritten all the internal medicine textbooks, pathology textbooks. What causes atherosclerosis? Anything that makes the blood clot. The biggest thing is high-fat diets like high blood cholesterol, high blood chylomicrons, high blood triglycerides. High-protein diets also cause increased blood cholesterol. I think it's because they induce an anabolic state whereby cholesterol is then pushed into the blood. It's signaled to be sent for by the tissues to build, to replicate cells, which can also accelerate cancer growth. That's why high-protein diets are a bad idea. Okay, hypertension, smoking, all these other known risk factors. Can atherosclerosis be reversed? I say, yeah, duh. Why do you think I'm writing this book? Okay, let's look at a picture here with an atherosclerotic plaque. It's easy to absorb the acute clot, the lipid core, that's the fat in the macrophages coming from the plasma membranes and organelle membranes in the cells, necrotic core, dead tissue in the macrophages. That can all be reabsorbed. A little bit of the cellular fibrous tissue reabsorbed, not the acellular fibrous tissue, collagen. Calcification, I don't think it can, even though some people claim it can be. I've seen many thousands of artery. I haven't seen it reversed yet, so I'll believe it when I see it. What doctors figured out that atherosclerosis was a blood clot? That's actually been known a long time. It's the pathologists, okay? And, these pathologists we sort of think of them as these irrelevant nerds who don't do anything useful, but the reality is they're the one that figured this all out. I used to think when I was a young guy, vascular interventional radiologist, imaging guided surgeon, I'd hang around with cardiologists and vascular surgeons and cardiothoracic surgeons. I thought we were the big dogs in the world of atherosclerosis because we're always doing balloon angioplasties, putting in stents, or doing surgical bypasses. Okay, but we really were just plumbers. We didn't understand the diseases. And this back in the 1850s, Karl von Rokitansky, a pathologist in Vienna, he wrote atherosclerosis looks like a blood clot. And I was lucky enough to be friends with Dr. Gregory Sloop, the greatest atherosclerosis pioneer of the atherothrombosis theory. And he said, look, you look under a microscope, it's a blood clot. That's what it is. And William C. Roberts, the greatest cardiac pathologist who ever lived, he said the same thing. You look at it under a microscope, it's a blood clot, an organized hematoma. It'll have recanalization pathways, it'll have lamination, all this stuff characteristic of a blood clot. Like once you have a blood clot, a small hematoma, the immune system comes in to try to reabsorb it, to clear it out with the macrophages. And then fibroblasts lay down fibrous tissue to heal it, and that'll also causes scar tissue and calcifications, okay? All right, so anyways, that's the big thing to know about atherosclerosis. It's a blood clot. You can go to William Roberts' YouTube channel. And again, I found it funny because the guy's the greatest cardiac pathologist who ever lived, but there's only about an average of 50 views for his lectures, okay? And then all the nonsense, paleo, keto, carnivore, bro science club will have millions of views for their lectures. Here's this great paper, William C. Roberts, Quantitative Extent of Atherosclerosis Plaque in the Major Epicardial Coronary Arteries. Those are the big ones on the outside of the heart, like the LAD, the circumflex, and the right coronary. In patients with fatal coronary heart disease, also in coronary endarterectomy specimens. And then he'll then give you his theory on. This is his legacy paper after a career over 50 years of analyzing coronary artery disease. It's the best paper ever written on coronary artery disease. Okay. I'll just give you one quote from the paper. Cardiac cath underestimates the extent of CAD, coronary artery disease, because it compares the stenosis to an adjacent area that it assumes is normal, but in reality, it usually does have atherosclerotic narrowing itself. So Dr. Roberts said that in general, 50% stenosis on cardiac cath would correspond to about 75% stenosis and narrowing at autopsy. Okay, so that's it for part one. Hope you found that helpful.